Quality of care is about time, and TeleTracking has certainly freed up time for everybody.
Before TeleTracking, we spent most of our time on telephones.
You're effectively eliminating unnecessary communication.
TeleTracking has freed up time for clinicians to actually see the patients.
Since it's been implemented, you can see a lot of changes, especially with patient flow.
It's all there for everybody to see, and you can see it from anywhere in the hospital as well.
The impact on patient is they get home safer and quicker, and patients waiting in A&E can get a bed quicker as well.
For our stroke service, the most important thing is we are such a large service. We're 53 beds. Operationally, on a day-to-day running, TeleTracking has allowed us to have the key pieces of information all in one place. That lends itself really well to giving some time back to our patients. Historically, if you attempted to know as much as you could about the patients, which was the right thing to do, you'd have to revisit certain information, you'd have to deliver that information around various key people in the trust. So actually it gives time, it gives clinicians time.
As a matron, it means that I can keep an eye on what's happening, keep an eye on flow, keep an eye on the pathways of our patients remotely, which I think is what's really beneficial to me.
It's been a game changer, really. It's been able to implement everything onto a computer system. When we see that a patient is coming in, we pick them up quite quickly, so we're always being proactive rather than reactive. So we're finding the patients we're able to see and treat them quicker, and then that has a knock-on effect on their length of stay, and they're actually able to be discharged quicker.
Getting a bed clean, we also had to spend time on telephones calling the domestics. Now, once the patient is discharged, we drop the badge and it goes brown on the system as soon as possible, and then the domestics know there's a bed on John that needs to be clean, and they'll allocate a patient already, so they know they need to chase up their job.
The training from TeleTracking has been really good. They've been on the end of the phone whenever we've needed them. They've come down before it was actually in place. They've done one-to-one trainings, they've done group trainings. They've also come to our meetings to actually see it in practice, to see whether they can advise us to use it in a different way.
Communication with patients' families and loved ones has improved because all of the information is central. So we're able to deliver quite quickly the information that might be required for the families to offer reassurance.
Our staff nurses and our clinical support workers feel more involved because it's a system that they can use and they can affect, so filling in the milestones for our patients.
Now we have TeleTracking, it's the information is centrally there for the key people to view and see. So I do think it's improved communication.
I think it's the best thing to get TeleTracking. It has improved patient flow at Maidstone Hospital.